Tip number 4, evidence-based. Here we go. Use the Teachback method. In healthcare communication, the Teachback method is one of the most effective ways to get patients to buy off and become part of their healthcare journey. What is the Teachback method? Well, that's where at the end of a visit, or even midway, you ask the patient, Mr. Jones, Mrs. Johnson, teach me back what you learned today at the visit. Now, they don't have to say it verbatim, but all you're looking for, are they connecting with the big ideas? For example, in that diabetes study, do they connect with the idea that foot health is and needs to maintain as a priority? If they don't teach that back to you as a provider, it tells you you need to improve your communication. What you think you said and what the patient actually received are very different. So use the Teachback method. The other thing that's so positive about the Teachback method is that when we use the phraseology of teach me back what you learned instead of tell me what you heard, the patient feels like they take ownership and that they get to teach you, the provider, something that you may not know, which is crazy. It's a crazy psychological shift, but it really promotes that patient autonomy that we always look for. So if you want to promote patient autonomy, use the Teachback method. Dean, Bonner, Ramsbotham, and Hines in 2016 did a lit review and found that the Teachback method helped patients with increased knowledge of their disease. It significantly improved adherence, it promoted self-efficacy, and it increased that patient autonomy through ownership of the information. Those are all great markers, leads to a better satisfaction. And look, if you increase knowledge of the disease, adherence, and self-efficacy, what are we saying? They're going to complete their care plans. They're not going to fall off your schedule. They're going to come to you as the expert because you are the one that shared the knowledge with them. All of those things grow your office and give the patient a better experience. So use the Teachback method. It's a best practice.